Alberta, a province of grandeur and beauty, rolling foothills, majestic mountains, vast farmlands, and prehistoric hoodoos. Albertans are known for their celebration of the cattle ranching industry and Western warm hospitality. Alberta's pioneering history, with a healthy dose of the Wild West, evolved through the 1800s with its medical heritage, building on the achievements and adventures of its frontier physicians.
It was the last part of Canada to be settled, and it attracted young people who had a lot of talent.
Physicians like the genial and business-savvy Dr. Robert George Brett, considered to be the father of medicine in the province. Doc Brett built his first sanitarium in Banff in the late 1800s and had more beds under his control than the CPR.
The enthusiasm of the West was a great drawing point, not only for the business world, but also for the medical world.
In 1905, there were only 150 doctors in the entire province, making their rounds to a population of a mere 150,000 through the harshness of landscape and weather by horseback and dog sled.
Coming to Alberta in the 1900s, not much here, just a province, and bringing new things to Alberta.
There are other very significant Alberta physicians and physicians who contributed to the medical framework of Canada.
In 1921, Dr. James Bertram Collop was asked to assist the Banting and Best team to solve a problem that they faced in their laboratory in Toronto.
And so Dr. Collop was asked to come back and join the team and see if he could isolate or concentrate whatever the extract they were working with was. He was able to do that. In fact, he did it in 2 weeks. And that became, in its pure form, is what we now know as insulin.
In 1924, with the population at almost 600,000, traveling clinics arrived. A team of 1 physician, 2 dentists, and 3 nurses vaccinated and examined more than 21,000 children across the province in the first 8 years.
They came and they stayed. And it was that stability that grew and allowed, as more came, for subsequent pioneers to build on what their predecessors had done.
Dr. Mary Percy Jackson was another Alberta medical pioneer who answered the call in 1929 to work in northern Alberta. With her indomitable spirit, she served the people throughout the vast, roadless wilderness of the north for more than 43 years.
Moving your family and going to a place that's not exactly a warm, nice climate or whatever, and setting up shop and trying to see patients and taking a little black bag, because that's all they had.
In the 1950s, a polio epidemic returned to the province. A field trial of the Salk vaccine was delivered to more than 37,000 children in one of the largest medical experiments in human history, and which led to the control of polio around the world. In 1956, Canada's first successful open-heart surgery using a bypass pump was performed by Dr. John Callahan in Edmonton. Alberta was the birthplace of the first provincially conceived health insurance program back in the 1930s.
Way before Medicare was even thought about, the doctors back then were thinking about how can we get care for our patients, for those who can't afford it.
And it grew rapidly. And by the time Medicare was introduced, it covered 71% of the people of Alberta.
Canada's medical research landscape was forever changed by the inception of the Alberta Heritage Foundation for Medical Research.
In 1980, the government accepted the establishment of that foundation and then funded it with $300 million. And that fully funded organization has made enormous contributions to not just the faculties of medicine, the medical research in Alberta, but well beyond the borders of Alberta.
I think we've had some amazing people doing some amazing things over the years. Many heralded, many not.
One of the marvelous facets of the Canadian Medical Hall of Fame is they have recognized some Alberta physicians by inducting them. Their contributions are exemplary, and not just Dr. Cochrane's and Dr. Collop's, but Dr. Terrell's, Dr. Mackenzie's, Dr. Scarlett's.
It's a remarkable legacy that they left to us, and I think we will leave to our kids.
They are heroes. They are models. They're models to be followed, and they're exceptional.